Hello, today we are going to have a new topic and a new chapter of neoplasia, and our first topic is the neoplasia. What is neoplasia? A neoplasia is an uncontrolled monoclonal proliferation of cells. What is monoclonal? The monoclonal produced by being or composed of cells derived from single cells. A single cell proliferate into different cells and abnormal uncontrolled growth is neoplasia and can be benign or malignant. A neoplastic growth have near two components. This thing you have to remember the two components of neoplasia. One is parenchyma and second spotting stroma. What is a parenchyma? The parenchyma is a functional tissue of organ distinguished from the connective spotting tissues. And the parenchyma, the mean neoplastic cells. Basically, parenchyma is a neoplastic cells and second part is spotting stroma. The spotting stroma are the non-neoplastic cells and non-neoplastic contain the blood vessels and connective tissues. If you guys see, the book is giving it one diagram regarding an normal, it says a normal structure. It is having basement membrane with apical pleurectine means proper sequence, a proper arrangement of cells, and having the normal nucleus and cytoplasm relation. The nucleus having normal size, cytoplasm having normal size. This is the things, basic thing a normal cell having, a normal tissue having, a normal basement membrane, a good sequence, discipline, and a normal size of nucleus and cytoplasm mean a normal nucleus and cytoplasmic connection. Our second thing, the normal cells facing any stimulus. If there's any stimulus that affecting the normal cell, then it will convert it into dysplasia. The dysplasia, the loss of uniformity in the thin sides and seed. If we talk about a normal cell having a basement membrane and apical polarity already, I told that having a normal sequence and order and discipline, and they are giving us a vital example. We're showing the normal and dysplasia spectrum. The first thing, dysplasia. The dysplasia is loss of uniformity. The uniformity you are showing in normal cells here. It will be disintegrated and it will be lost. The cell size will be increases and the shape is also increases and it is called pure morphism. The pure morphism in multiple forms of morphology within the same species and the same cell having. For example, it is a one cell and it will after dysplasia is looking like that, looking like that, looking like that. The cell is seen, but after a different condition, it is taking different shapes. It is pleomorphism, in which is a lot of tissue orientation and nuclear changes. What I told you, the normal cells is the normal nuclear cytoplasmic ratio. But in dysplasia, the nuclear cytoplasmic ratio will be increased. If you get taking the side of nucleus is so much big, fitted in cytoplasm. And it often reversible. Dysplasia is often reversible, but if we are not controlling that good from growth, if we are not controlling the dysplasia, then it will convert into carcinoma in situ. It's a pre-invasive stage carcinoma in situ on the surface of the epithelium. And it's an irreversible sphere dysplasia. It is irreversible sphere dysplasia, but it involves entire thickness of epithelium, but does not penetrate the dead basement membrane. The basement membrane will be normal. The basement membrane will be normal. If you guys check, the basement membrane is normal. It is not harming the basement membrane. But till that, carcinoma in situ, all the thickness of epithelium is affected, but the basement membrane is normal. If you are not treating then it will be invasive carcinoma. Invasive carcinoma, the cell have invaded basement membrane. When the basement membrane becomes disformed, this abnormality, it is disrupted by the help of some enzymes like collagenase and hydrolysis or the metalloproteinase enzymes, They're into collagenate. You know the basal membrane make of collagen, and collagenase enzyme disrupt the membrane, and it will invade it into different parts of organ and also in the blood vessels. And it also damage the cell-serine contact. It is lost by the inactivation of ecadherins. Ecadherins maintain the cell contact with each other, make them together, but when the ecadherins inactive, the cell will spread and invade it to different sites. And then it will be stage of metastasis, in which it will separate to distant organ. After going to blood vessel and lymphatics, it will separate to other organs, for example, liver, lungs, heart, brain, etc. So separate to distant organ where the lymphatics in. Like if we are talking of the ovaries, in ovaries you will get non-David menstrual cycle happen, and then the retrograde blood, the retrograde flow of the blood help to metastasize this cancer to different organs like lungs, liver, heart, and the brain. Now we're coming to a next topic, that is tumor nomenclature. In the naming of cancer, how we have to name the tumor according to its origin first. The carcinoma, if it's the origin from epithelium, then it will be called carcinoma. If a tumor is origin from mesenchyma, its origin is mesenchymal, it's called sarcoma. What is mesenchymal cells? The mesenchymal cells are a type of cell found in embryonic connective tissues that called mesenchyme, which is responsible for forming various other connective tissues like bone, cartilage, and blood vessels. And they are also important for the development of smooth muscles and other tissues. Then, if any tumor is arising from bone, cartilage, blood vessel, then it will name it and then sarcoma. And these both terms, sarcoma and carcinoma, are generally related with malignancy. Tumor with malignant, if any name for tumor is ending in carcinoma, sarcoma. These are two types of tumors you already know, the benign and malignant. Benign tumors are usually well differentiated and well demarcated. Well differentiated means resemblance of abnormal cell, like normal cell, it look like that. And these are benign tumor, it's also just like that. Okay? These poor cells having some resemblances, physical appearance, and seem a bite. If find normal cell stays after that, if you can retain to like that, it means they're not looking. Details are not well differentiated. Is it not resembling each other? Then it is low differentiated or poor differentiated. When the cell is a poor differentiated, then it is a malignant. If it's well differentiated, it's a benign. And with low mitotic activity, it's not growing rapidly, not fastly, and no metastasis and no necrosis. The malignant tumors, also cancers, may show poor differentiation. It is not resembling with the normal cells. He have an erratic growth, rapid growth, with a local invasion level in way to the blood vessel and lymphatics, and it will be metastasized through the organ, and it will be decreased in apoptosis due to differences. And if you guys remember, the apoptosis, there are two pathways, extrinsic and intrinsic. And extrinsic pathway, therefore, BCL expression. If the BCL expression will be increasing, there will be no release of cytochrome C, and there will be no cell death. And in extrinsic, there will be the fast ligand interaction. If the cell have it not the fast ligand, then there will be no cell death. And more locally, the extrinsic pathway abnormalities cause lymphoma, leukemia, and blood cells tumors. The term for the known neoplastic malformation named with hamartoma. Hamartoma means disorganized overgrowth of tissues in their native locations, and there is a post-traumatic polyps. The post-traumatic polyps includes a syndrome having hamartosis polyps, and there's a pigmented lesions on the lips and the mucus layer. And most commonly it is happening in the stomach and intestine. And these are one more term that they call stroma. And stroma in normal tissue is foreign locations, like gastric tissues. Like I'm taking one example, gastric tissues, okay, like in stomach, gastric tissue are present. But unfortunately, in the intestine, the ileum, gastric cells are also present. Okay? But it is its native location where normally it's present. But if the gastric cells start to overgrow the overgrowth of cancer cells in their own location kan hematoma. And if the gastric cell is growing in the ileum abnormal place, not in their own place, then it becomes choriostoma. Choriostoma. And it becomes hematoma. Choriostoma and hematoma. And this example, the gastric tissue located in this ileum is example of a diverticulum was they having make a diverticulum. Like now we are going to read about the naming of cancers, like if it's the epithelial, then if it be carcinoma, like adenocarcinoma, precarcinoma, it will be malignant. First we'll start for now. Malignant type of these tumors. Okay, if we are talking about the mesenchymal, then it will be under sarcoma. But there is some exception like lymphoma and melanoma. If the blood cells is going abnormally and they have a malignant, then it will become leukemia and lymphoma. If plaque vessels are doing that thing, abnormally growth, and there is a malignant and angioma in blood vessel and sarcoma mean malignant growth. The name is angiosarcoma. Leiomyoma mean spoon muscles, and if we've having the growth abnormal and malignant than sarcoma, and meanwhile, leiomyosarcoma. Stratic muscle includes cardiac muscles and skeleton muscles. If they are growing malignant and doing overgrown neoplastic malignant growth, then their name will be rhabdomyosarcoma. Connective tissues are fibrosarcoma, like fibro mean connective tissues, and sarcoma mean malignant growth. Bone osteo mean bone, and if it's growing malignant, then it will be osteosarcoma. Lipoma mean fat, and sarcoma mean malignant growth. If there is a growing malignant growth, the fright will become liposarcoma. Melanocytes, melanoma is the exception. Whenever a cancer with ending in oma, it is a benign, but there is the exception of lymphoma in melanoma. Like seen epithelial, benign tumor way, adenoma, papilloma. It will end on oma, it will end on carcinoma and sarcoma. Carcinoma for epithelial origin and sarcoma for mesenchymal origin. Mesenchymal into blood cell, blood vessels, smooth muscle, etc. If blood vessels having benign growth and hemangioma, smooth muscles, neomyoma, straight muscles, rhabdomyoma, connective tissue fibroma, bone osteoma, fat lipoma, and melanocytes scarf mole or navis. Normally, when you first having the mole on the face, perhaps having. Now we're talking about the tumor grade and stage. There is tumor grade and the stage. What is a grading and what is stage? The grading means cell differentiation or resemblance. How much a dysplastic or neoplastic cell is resembling to normal tissue or normal cell. For example, it is one cell and this is the normal cell. Did this shape is look like that? No, then it's poor differentiating. This is a abnormal cell and this is a normal cell. It's a little bit looking like each other. Then it is well differentiated. The resemblance mean grading. A tissue of origin resemblance cell differentiation is grading. So the low differentiation, the low grade, the low grade cancers are well differentiated and they are mostly benign. And high grade are poorly differentiated and they are malignant. Okay? And mitotic activity on histology, how rapidly they are growing. Okay, the higher grade often correlate with the higher accretiveness. So these are anaplastic tissues having high grade for the anaplasty. The anaplastic are term used to describe cancer cells that divide rapidly and have little or non-resemblance to normal cells. And these are low-grade high. The low-grade is also known as well differentiated tumor. It's a type of cancer where the tumors that look and behave like normal cells. But high-grade are poorly differentiated tumors. It's characterized by rapidly growing and spreading cancer cells that look very different from normal cells and tissues. And a stage mean degree of invigilance apart from initial state. Like for example, this is a cancer of a surgery and it is spreading to the lung, to the heart, and it is a other organ that is invasion. It is invading from its own origin to the other sides like blood vessel lymphatics, is staging, and it is basically on the clinical and pathological findings, and the staging is dividing DNM. The DNM stands for T for tumor size, and in region the regional lymph node dead metastasis and distant metastasis. M stand for metastasis to other organs, and N stand for not metastatic lymph nodes. How many lymph nodes? For example, neither N1, N2, N3. N1 means one lymph node involved. 2 means 2 lymph nodes are involved. And 3 means 3 lymph nodes are involved. I mean how many organs are involved, how many metastases happening after it's a cancer. So, for example, the cervix cancers is spread to the lungs only, then it will be M1. If it's spreading to lungs plus the liver, then it will M2. If you're into heart also, then M3 and going to brain, then M4. Okay? The 1, 2, 3, 4 is given how many organs are involving. 1, 2, 3, and is given how many lymph nodes are involved in it. T stand for the size. How much it is getting in reinforced attribute T1 mean to the epithelium. T2 mean the muscular parts are getting involved in that organ. And then after layer involvement, and then T3. Okay? Stage generally has more prognostic value. And more, that is important. The staging is more important than grading. Because staging giving us the prognostic value, how much the patient getting better, and these are related with survival of the patient. Stage determines the survival. Stage means how many the cancer is separating. So stage generally has more prognostic value than the grading. And if one patient has a high stage cancer and low grade tumor, then due to high stage, it is near to death. Fine. If it having a low stage and hybrid tumor, then this condition not worse than high stage cancer having. Okay? So the staging is more important in the grading because it is given prognostic value. Okay? And if I again summarize that thing, then the grading means the degree of cell differentiation, how does it differentiating from normal tissue resemblance to the normal tissue, and staging mean how much the cancer invading and spread from the initial type to other organs at other sites. In tumor nomenclature, we have naming of tumor and the cancer, the carcinoma. Related to epithelial origin tumors, and a sarcoma means mesenchymal origin tumors. And for the benign, mostly these are oma in the large of names, with exceptions at lymphoma and melanoma. And for the malignant, if a cancer is epithelial region, then carcinoma. If it is a mesenchymal region, then it is sarcoma. And there is a neoplastic progression, how it is normal cells having a stimulus by stimulus that make a growth adaptation, the metaplasia converting dysplasia. If you did not treat that dysplasia, it will convert as a carcinoma in situ. And if you are not treating that, the pre-invasive carcinoma, then it will convert into invasive carcinoma. And then invasive carcinoma go to metastasis to other organ, and then you have to come to palliative care, and then after some time to become die, likely to death.